Thank you for joining us for this unique MD Magazine peer exchange entitled Appropriate Treatment for Incarcerated People with Schizophrenia. Although statistics in the criminal justice system are notoriously poor, a conservative estimate suggests that nearly half of America's incarcerated population is mentally ill. Correctional officers find themselves at the front lines of mental health treatment, even though they often lack clinical training. Living with any mental illness, including schizophrenia, is daunting enough for an individual, but being incarcerated can only make things worse. In this peer exchange panel discussion, I'm joined by a group of highly esteemed colleagues to talk about the unique and costly problem of keeping the mentally ill in correctional facilities rather than in medical treatment centers. I'm Dr. Peter Salgo. I'm a professor of medicine and anesthesiology at Columbia University College of Physicians and Surgeons in New York, and an associate director of surgical intensive care at New York Presbyterian Hospital. Now, joining me for this panel discussion are Dr. Richard Jackson, a founder and owner of the Neurobehavioral Medicine Group in Bloomfield Hills, Michigan. Judge Stephen Leifman, chair of the Florida Supreme Court Task Force on Substance Abuse and Mental Health Issues in the Court, and associate administrative judge for the 11th Judicial Circuit Court of Florida, Miami, Florida. Dr. Nika Jones-Tapia, former executive director of Cook County Department of Corrections in Chicago, Illinois, now a leader in residence and licensed clinical psychologist at Chicago Beyond in Chicago, Illinois. Dr. Mauricio Toan, professor and chairman of the Department of Psychiatry and Behavioral Sciences at the University of New Mexico Health Sciences Center in Albuquerque, New Mexico. I want to thank all of you for joining us, and why don't we just launch into this thing? Mental health problems that we see in America's correctional institutions, and we were discussing this before. There's a difference, right, between prisons and jails? You might want to spell that out.
Yeah, jail is where people are usually waiting to go to trial. Prison is after you've been sentenced, usually to more than a year. And the state pays for the prison, the local county pays for the jail.
And I'm assuming federal prison, the feds pay for.
Correct.
Let's get this all on the table before we start.
But most of your prevalence of serious mental illness you're going to find in jails and prisons, not so much in the federal system.
Okay. Now we're talking here, I introduced the broadcast with the word schizophrenia. Let's get a couple of definitions on the table if we can. I'm going to look for my clinical colleagues here. The difference between, and I want to broaden this beyond schizophrenia, but let's stay here for a moment. The difference between schizophrenia and schizoaffective disorder. Who wants to go with this?
Well, schizophrenia is a disorder of, mainly thought of as a disorder of thought where patients have hallucinations, delusions, the classic presentation of schizophrenia. Schizoaffective disorder has that plus, in addition to it, some type of mood disorder, either depressive disorder or what we refer to as bipolar disorder. So they have significant either elevated mood or significant periods of depressed mood in addition to their psychotic symptoms.
You know, I think a lot of folks, both medical and otherwise, are buying into this, the popular view, which is ages old and wrong, of schizophrenics as being multiple personalities. I mean, that's nowhere near true, is it?
No. I think the prevalence of schizophrenia in the population is somewhere around 1%. Okay. And I don't quite know the prevalence of those with multiple personality disorder, but it's quite rare. And it's a personality disorder as opposed to a psychotic disorder.
Now, if we want to broaden this, I think schizophrenia is certainly a very important problem, but let's pull everything in if we can. All kinds of serious mental illness. What's the percentage among incarcerated individuals? Do we have a number? Is it reliable?
We do. It's a very good study. It was done by Dr. Stedman and Osher, and they found about 17% of the population in jail have a very serious mental illness. Okay. And it's interesting because 33% of women in jail and prisons have a serious mental illness, and about 14% of men. And part of the reason we know that is because trauma has a significant role. And one of the worst statistics you'll ever hear is about 92% of women in jails and prisons in the United States with serious mental illnesses were sexually abused as children. And this is a major contributor to these illnesses, and it's what often leads them because we don't identify it at an early stage, we don't treat it at an early stage, and they end up in the criminal system because we've done just a horrible job dealing with these illnesses in the community.
You know,
And I'm sorry, if I can also add, in larger cities, I think we're even seeing higher prevalence rates of trauma. So like in Chicago, I know we did a study with the Illinois Criminal Justice Information Authority and found almost 90% of people coming into the criminal justice system had histories of trauma. And that's something that we don't often talk about in correctional
is that
systems.
men and women? Or
Men
just,
and women.
It's about 75% of men and about 92% of women.
I mean, I'm flabbergasted, frankly, only because it hasn't really been made public. Is it because they don't want to talk about it? No one's done the research?
It really begs the different question is, why aren't pediatricians in schools screening for
Right.
these issues at an early stage to prevent these folks from growing up into our criminal system?
All right, Your Honor. Let me pose that question to the panel. Why aren't pediatricians, other clinicians who have a responsibility to protect our children, why aren't they screening for it?
Well, unfortunately, it's not simple, easy screening for severe mental illness. For the most part, mental illness presents later in adolescence and early teens.
But I think his point was not so
Right.
much mental illness, it was trauma.
Trauma.
as-
Right.
Trauma, sure.
And we
Right.
can
Exactly.
screen for ACEs in schools,
Exactly.
especially if we're talking about real mental health parity. Schools and pediatricians should be looking at screening for trauma, especially because we know the high rates of trauma going into our correctional institutions, and it's a mismanagement of funds.
But shoulda, woulda, coulda, why don't we?
But actually, I think an important point, so we're talking about serious mental illness.
Yeah.
And what comes to mind is schizophrenia. But in fact, the majority of individuals with serious mental illness do not suffer from schizophrenia. They either suffer from bipolar disorder, depression, or trauma. In fact, of those four conditions, perhaps the one with the lowest prevalence is in fact schizophrenia.
But nonetheless, schizophrenia is a big problem.
And they tend to be the highest utilizers in the criminal justice system. So we had a study conducted. We wanted to know who the highest utilizers of criminal justice and mental health services were in Miami-Dade County. We have this wonderful program. So the University of South Florida has this incredible capacity to tell a community who this population is because they have all this data on criminal justice, all the data you need to identify it. So we sent them the names of thousands of people that had been through our system because we wanted to see if we could wrap our hands around a smaller subpopulation. Somehow they narrowed it down to 97 people, primarily men, primarily people with schizoaffective schizophrenia disorder, primarily homeless, primarily co-occurring, who over a 5-year period of time were arrested 2,200 times. They spent 27,000 days in the Dade County Jail, 13,000 days at some type of psychiatric facility, cost taxpayers $13.7 million, and we got nothing for it. And it was mostly people with schizophrenia because the treatments in the community are not effective enough for people with serious schizophrenia.